6:14 now. COVID-19 numbers are trending in the right direction. You can actually see here from this graph, this is from the St. Louis Pandemic Task Force, that over the last month, well, they've been going on a downward trajectory. That's good news. But despite these numbers, healthcare workers on the front lines are still seeing packed ICUs. I recently had the opportunity to tour the ICU and step-down unit at SSM St. Joseph Hospital in Lake St. Louis. Here's what I saw.
And a lot of times we see death. It's really, really hard.
The sounds inside the ICU at SSM St. Joseph Hospital are relentless.
These sounds are the sounds that we hear every day in the ICU. And this is reality. And this is not a reality that we want people to have.
Staff say it's even worse in the area known as the step-down unit.
Feels like there's a lot of tension on this floor.
Yeah,
is there a lot of high stress
This
here?
is the saddest place in the hospital because this is where people decide if they want to go on life support or if they don't. So this is the unit where people die.
Respiratory therapist Melissa Scholl gave my photographer and I the tour. At the beginning of October, more than 300 people were hospitalized with COVID-19 at St. Joseph. 80% of them were not vaccinated.
I can tell you of all the patients we've had, I can think of 2 that were vaccinated with severe symptoms. Only 2 out of the hundreds.
We briefly spoke to some of the other nurses working the step-down unit.
There's actually one point, 1 in 9 of my patients was dying a week.
What happens if someone comes here and you guys don't have any room?
We would try to find a bed elsewhere in a different hospital.
But this floor is full and the ICU is full.
The biggest difference between this wave of COVID-19 and the first is that patients are much younger now. This graph from the St. Louis Pandemic Task Force shows the majority of those hospitalized are between 45 to 64 years old.
COVID doesn't care. If it takes you, it's gonna go full force.
Infectious disease specialist Dr. Mano Patri says there's no way to tell how COVID might affect you.
It's a gamble. You may be fine, but you may not.
And sadly, these healthcare workers say they witness a lot of regret. One woman in particular sticks with Scholl.
She was on a lot of oxygen, and I was talking to her, and she told me that the minute she gets out of the hospital, she's going to go get the vaccine. And she told me that she was going to encourage her family to do so as well. And she didn't make it.
That woman she was referring to was 70 years old. Coming up tomorrow morning here on Today in St. Louis, I introduce you to a mother who has spent every day of the last 3 weeks in the ICU with her son. And this isn't the first time COVID has devastated her family.
I lost my husband to COVID today, this day, a year ago. So it's been a second nightmare around, yes.
Pat Meese says her faith is what's gotten her through this last year without her husband, and she prays it will pull her son off a ventilator. We sit down with Meese and her son's doctor. That's coming up tomorrow morning on Today in St. Louis.